The theme of our conference is leadership with responsibility, and we are not only calling for this, but we want to be part of the leadership and we want to share the responsibility. However, we need to be invited in. We're knocking on the door with ideas, and there must be true and honest engagement. As your representative organisation, there is much to do for our members on the industrial relations front. There is a misconception that all industrial relations is about securing new pay deals. While this might be the issue that attracts greatest attention, much of industrial relations is concerned with the implementation of negotiated terms and agreements. There is an opportunity, therefore, for the IMO and its members to use this time productively in order to be creative in resolving and addressing many outstanding issues about the implementation of agreed contracts, as well as budget-neutral issues which will make the practice of medicine more effective. Turning to our NCHD members, the past 6 months has seen the most blatant attack on this group by the HSE, even considering the economic context. Not only is the attack on their contractual terms and conditions, but also on their development of their careers in medicine. NCHDs have always been a vulnerable group within the health service due to the structure of their training. It was worth remembering that only 20 years ago, the more hours NCHDs worked, the less they got paid. The IMO position is, and will remain, that every hour worked must be paid for. To cut through the spin from the HSE, let us be clear what the proposed cutbacks will actually mean for NCHDs. Up to a 40% drop in income, no agreed contract beyond the 1st of July 2009, overtime rates slashed, unpaid training, and a curtailment of all allowances. No one can seriously believe that such measures will have anything other than a serious negative impact on the provision of services to patients. Additionally, the effect on their careers due to the lack of training will be detrimental. Loath though I am to say it, many of our best and brightest young doctors may feel they have no option but to move abroad and work within a system which values them. Another point I want to make quite clear is that the HSE move on NCHDs was unilateral. The IMO, for its part, engaged with the state's industrial relations machinery with workable, rational proposals which would see a reduction in NCHD working hours, thus saving the state significant money. However, our overriding prerequisite was and remains the issue of patient safety. Sadly, the HSE paid nothing more than lip service to this process and then blatantly misrepresented the IMO's position in regard to referral to the Labour Court. As has now been clarified, the Labour Court never issued an invitation to either party to hearings. Therefore, we could not have refused an invitation which did not exist. NCHDs have wholeheartedly supported the IMO in its attempts to address these matters. Despite the fact that strike action is an anathema to doctors, NCHDs balloted for industrial action with a resounding 99% support. Any decision on industrial action will be carefully and judiciously considered in consultation with the NCHD Committee and our hospital representatives. Additionally, we are pursuing a legal action for breach of contract against the HSE, and hearing in the High Court is due to begin on April the 28th next. As I speak to you today, the position is that the HSE have proposed to postpone the implementation of the cuts they announced pending the conclusions of the High Court case. To my great surprise, one of the proposals from the HSE was that from the 1st of July next, NCHDs would work without any contract, and that their terms and conditions would be notified to them at the whim of the HSE. The IMO position is clear. We are a trade union representing more than 4,000 NCHDs in this country. There is a contract currently in place with obligations on both sides, and which remains in place until such a time as a new contract is agreed between the parties. Stepping aside from this current issue, the IMO has developed an NCHD strategy as part of the IMO strategic plan, which sets goals and objectives for the NCHDs as a group, which include manpower career paths, career development, training issues and workload. We have a clear vision and understanding of NCHDs that takes account of their unique position as doctors in training, and we will simply not condone or tolerate any further exploitation of our younger doctors. These are challenging times for our general practitioners. GPs are the immediate responders to citizens who need access to a doctor and who are met at all times by a group of professionals who deliver high-quality services on a same-day basis with equal access to all citizens. These very words encapsulate the essence of general practice in Ireland. General practitioners have been repeatedly told that they are the solution to the efficient delivery of healthcare in this country. They have been told that they are fundamental to the reconfiguration of all health services, not just primary care. General practitioners have been exhorted to rise to new challenges, to be progressive, to develop, to integrate well, to do everything they have already done without much help from the state. This is the same state that effectively stymied negotiations for the past number of years due to its interpretation of competition legislation. While our position always remained that general practitioners are entitled to negotiate their terms and conditions, it appeared that we were going to be forced to defend this entitlement in the courts. Following the government's budget decision last October, the IMO, having been invited by the Taoiseach to talks, obtained an agreement that the government will amend Section 4 of the Competition Act, which will remove any doubt with regard to the IMO's right to negotiate on behalf of general practitioners. That moment when the government realised that it couldn't prosecute its business without having a representative professional organisation to deal with was a singular one for the IMO and general practice. It is important not to underestimate the impact that this substantive achievement will have. In passing, it deserves noting that general practitioners were the first group to agree a significant contribution of 36 million, representing 8% reduction in gross fees, through resolving economic, financial and budgetary difficulties. How unreasonable, therefore, that general practitioners may now be required to make an extra 8% contribution when no other comparable group providing services to the state have been foisted with such an additional reduction. In our submission to government on this matter, the message for the HSE and the state is that if you actively undermine the resources of general practice, the effect will be one of retrenchment, where general practitioners and practices will be forced to cut overheads and operate their GMS contracts to their barest requirements. It could mean job losses for practice staff. It would mean that many of the pro bono services, such as water monitoring and phlebotomy, would be transferred back to the hospital sector at a greatly increased cost to the Exchequer. It will worsen queues for outpatients and A&E departments. It would considerably delay the rollout of primary care teams and the implementation of the primary care strategy. At the same time, the HSE expects general practitioners to accept an increasing and more complex workload, while at all times providing minimal support. This attitude to general practice is grudging and minimalist. We in the IMO are open to mature and realistic dialogue based on mutual respect. In spite of this, general practitioners should not be too pessimistic. The IMO has conducted a comprehensive benchmark study of general practice and has developed a strategy to support, promote and develop this specialty. We have identified a significant body of work which will be undertaken in the coming months to address issues such as entry to GMS, to alleviate areas of shortage of general practitioners, and to ensure that uniform access to high-quality general practice services is maintained throughout the country. Additionally, we will work with the HSE on GMS manpower and on our proposals to reduce significantly the onerous administrative burden on general practitioners and in encouraging the rollout of new primary care centres. It will also be important for the IMO to support general practitioners in managing their practices in this new environment. To this end, we are currently preparing practice management material for our general practitioner members. General practice has significant potential, and the IMO is determined to see that this potential is fully realised for patients and doctors alike. Turning to our consultant members, in 2008 a new consulting contract was finally offered for consideration. But having considered the offer carefully, the IMO was not in a position to recommend acceptance or rejection. At the time, we had serious concerns in regard to its implementation. Notwithstanding this, many consultants in good faith signed up to the new contract, but unfortunately, our initial concerns have proved justified. You will remember that for the past number of years, the government and HSE mantra has been that a new consulting contract would solve all the ailments of our public hospital system. It gives me no pleasure to tell you that nothing could be further from the truth. This is a new contract with significant changes to work practices, and at the first hurdle, government did not honour its commitment and refused to pay monies owed on the spurious excuse of the non-appointment of clinical directors.